All right. Alexa, play some classic rock.
The station, Classic Rock, on Amazon Music.
Alexa, stop. Alexa, play classic rock on Spotify.
Classic Rock Mix from Spotify.
Alexa, turn your volume to level 2. All right. What is going on? How's everybody doing? The White Witch. Good evening. Ready for class? Hell yeah, that's what I'm talking about. That's what I'm talking about. What's going on? What's new? What is new? Let's let some more people jump in here. Stop. Regal Golf. Oh my goodness. Regal Golf said, I passed my NCLEX yesterday. I actually wanted to intentionally start this live and future lives off with just some congratulations and people calling out their wins. So amazing. Amazing. Love that. Yeah. Send me a DM. Just, I'd love to chat with you more about it. So that is awesome. Fantastic. Yes, my face changed and my hair changed a little bit. I got cut, you know? Yeah. I want to gift 4 people well, Regal, right now what you're doing is exactly what helps me, is just being the testimonial and telling the people that the study plan works, right? And for those of you who don't know what Regal's talking about, is if you go to the link in my bio, there is the ability to get a custom study plan. Queen, head there now before we get started. All right, so you just go to the profile on my main page, okay? You go to the link in my bio and get your custom NCLEX study plan. All right, Conquer, yep. It's there. It's $25, but it's worth it. So it asks for some information. I'll get them back in 24 to 48 hours. All right. But they do help you pass the NCLEX. Okay. All right. Let me get started. What else are we doing here? All right. And cool. And I can. Oh, look. Hold on. I'm in the chat. I just chatted because I got you guys pulled up. So I'm testing a couple different things right now. Things are working. Love it. Okay. So let me get my Windows set here. Okay. Pull that there. What else? Morgan, good luck. Yeah, so I think Morgan's taking the NCLEX soon. Morgan is also a recipient of a custom study plan. So good luck, Morgan. Go to my NCLEX playlist and watch the last video if you haven't. The one that says it's me in a red shirt and says day before your NCLEX. All right, go check that out. All right. So let's get going here soon. Any other wins? Do we have any other wins? I'd love to spend just like the first it's 9:01, the first 5 minutes of the live, just saying, hey, does anybody have any wins? Has anybody taken the NCLEX? Passed? Is anybody about to take it soon? Morgan's about to take it. Regal Golf just passed the NCLEX on Wednesday, I believe is what she said. So fantastic. Love to see it. All right. 3 people who doesn't have. Regal is, I think she is actually serious about gifting the study plan to 4 people. You are so cool. That is awesome. So I guess if you guys are interested in the study plan, hit up Regal Golf. That is so cool. That is like one of the coolest things that's like ever happened in the chat here. I'll pop her in there. But if you guys are interested in the study plan, you can go to the link in my bio. All right. You can go to the link in my bio. It's $25. You can get your study plan there. All right. So let me get up the question doc. Are you guys ready? Are you guys about ready? We got 60 people in here. If you guys are ready, I need you guys to go down and just repost this live so that we can get some more people in here. All right. If you guys are ready, I would love and appreciate if if all of you would repost this live so that we can get some more people in here. All right. Morgan, I'm stressed about meds. I know all the most important ones, but not the random ones. That's okay. Hopefully you just saw my recent video, okay? You do not need to know every single med. You just need to be very comfortable with the suffixes, what the types of meds are, generally what they're treated for, all right? So check out that last video that I did. It's like one of the last 2 videos, okay? All right, so today we are doing questions on Medsurg, fundamentals, and cardiac, all right? Kat says, do you have any oncology questions you can review? I don't know if there's gonna be any specifically in my Medsurg batch tonight, but maybe I don't have anything specific oncology, okay? But all right, so let's jump into it, shall we? Shall we jump into it? 9:04. Morgan says, can we do OB on Sunday? Sure. Let me I'm just gonna take a screenshot because I'll look at these later. All right, so we'll do some OB on Sunday, Morgan. Okay, Venus is like, yes, let's do some OB. Let's do it. Okay. All right, guys. Without further ado, all right, let's jump into question 1. All right, let me get this up and then resize it. All right, here we go. And for those of you who did not come and did not see the live on Tuesday, we did some question strategy. So we'll kind of work it in. We will work it in to each question. I'll kind of go about explaining it, but basically when you read these questions and just the question, you should ask yourself, what does this question want me to do? Does it want me to assess, intervene, evaluate, or teach? Okay? You guys, make it bigger. Okay, I can make it a little bit bigger. How about that? This is a question with a lot of detail. Okay. I'm viewing it on my screen too for quality and looks to be pretty good. All right. Okay. All right, guys, what are we thinking here? All right, these first few should be pretty straightforward, okay? Seeing a lot of A's, right? Okay, so we're reading this question. You know, which client should the nurse assess first? Okay, so yes, this is, we need we need to take a look at A, right? The client post-cardiac cath who reports new lower back pain and feels sweaty. All right, we have to see that person first. Okay, new lower back pain after femoral access plus diaphoresis, huge red flag for retroperitoneal bleeding and hemorrhage. Thank you guys for the gifts, much appreciated. Yeah, this is time sensitive. All right, so I'm not gonna belabor that one. So there you go, question 1. Question 2. Here we go, guys. These first 10 should, I feel, be pretty straightforward. I didn't make these first 10 super challenging. Let's just get your brain working. Get your brain working. So what is the nurse's best initial action? All right, so what are we thinking? Obviously, A, nurse Jimmy, can I send you their name and I'll pay for them? Regal, probably the easiest thing to do, I'm just thinking out loud here, is maybe to just Venmo or PayPal them the cost of the plan so that they can then fill it out and pay for it, you know. I think that because it requires a lot of information from them, you know. How does that sound? You can also DM me, okay? All right, so I'm seeing some A, quite a few B's, some C's. All right, guys, so the answer here is going to be B. All right, the answer is B. Hold the metoprolol and clarify the order set before implementing conflicting therapies, okay? Because the client's hypotensive. They have poor signs of perfusion, okay? Like, i.e. the low urine output, pulmonary congestion, okay? A beta blocker can worsen the hypotension and decrease cardiac output, all right, in this like acute decompensation. So then on top of that, a fluid bolus may worsen pulmonary edema. Okay, the nurse must clarify priorities in order to avoid harm in this situation. All right, some of you said A. Okay, a bolus here may worsen the crackles and oxygenation. So this needs clarification given that there's already signs of fluid overload. Does that make sense? Drop a 1 in the chat if that makes sense. All right. Looks like A and B were the only answers there from you guys. All right, I'm seeing lots of 1s in the chat. So awesome, awesome, awesome sauce. So let's jump into question 3. All right. Alexa, turn your volume down. All right. Thank you guys for the follows. Thank you guys for liking the live. And thank you guys for also sharing the live so that we can get some more folks in here. All right. If you guys haven't followed and you're in here or you're on the For You page, we do these lives every Sunday, Tuesday, Thursday at 9 p.m. Eastern, where we do NCLEX study sessions. We do review questions. Tuesday, we did a question strategy live. So come join in. All right. So number 3 here, the majority of you are pretty much every single person I've seen said B, and that's correct. Okay, yeah, we're going to stop the heparin here. New bleeding signs, okay, with a significant platelet drop while on heparin, okay, suggest not good things, right? So we need to stop that ASAP. Good job. That was pretty straightforward. Let's go to 4. All right, good old digoxin. All right, hopefully this should be a gimme. Hopefully this should be a gimme for you guys. Okay. Answers are starting to flow. Yep. All right, guys, great. Yes, absolutely. We're going to B, bravo. We are going to hold the digoxin and get an ECG. All right, and an electrolyte panel. So the reason behind it is that the bradycardia, the visual disturbances are suggesting that there's some digoxin toxicity, all right, which is going to be worsened by hypokalemia from the loop diuretics and general poor intake, okay? So the priority is to hold the medication and evaluate the rhythm and electrolytes, okay? Especially potassium there as well, okay? So when you think digoxin, think also that we need to make sure their potassium's okay. All right, thank you guys for the follows. Thank you, thank you, thank you. All right, so let's jump into question number 5. All right. Topics. I'm going to drop the topics in the chat and we'll pin it. All right, well, I'm trying to pin my comment. All right, so yes, you guys are all over it. The answer here is going to be B. We're going to place them in supine. So they're hypotensive. They have signs of poor perfusion after nitro. So the immediate action here is an intervention, all right, because this patient is unstable. So we need to intervene. And so the immediate actions need to focus on perfusion and safety. All right, perfusion and safety. All right, good job, guys. All right, let's go 6. Here we go. All right, thank you guys for following. Thank you guys for sharing the live. If you guys are 175 of you in here, if you haven't already, I would much appreciate if you guys would share the live to get some more people in here. All right. Yes, 5 was B. 5 was B indeed. Okay. Mimi says, why supine? Yeah, we're going to play supine to help with the hypotension. Okay. All right. So question 6. So answer here. You guys again are all over it. B. So place a call light within reach. All right. So the question: which intervention best addresses client safety? So absolutely. So this is a fundamentals and safety priority. So you have a patient who's drowsy. They have impulsive ambulation. They don't know. They don't understand their own limitations, right? So you need to put some environmental controls and scheduled toileting alarms in place. Okay, that is the answer that makes the most sense here, guys. So good job. Question 7. All right. The question, the last one was B, and question 6 was B. Bravo. All right, if you're jotting these down. Did you get that, Hamdi? All right. All right. Hello, Jane. Jane Francis. All right. I'm seeing a lot of C's coming in. Oh, there's Maddie Griswood I see in the chat. Awesome. Good to see you, Maddie. Maddie's also a recipient of a NCLEX study plan. Hopefully that's working out for you, Maddie. All right. So yeah, guys, absolutely the answer is C. All right, Kat, thanks for sharing the live. We are going to avoid soaking or applying heat, right? Because we have a patient with decreased sensation and that increases burn risk, okay? They have peripheral artery disease, which is going to decrease perfusion and impair healing. So common teaching instructions for these patients are going to be avoid heat, prolonged soaking, right? You need to tell them to inspect their feet daily, do good skin care. All right, all of that to prevent any worsening injury and infection. All right, Brenda, thanks for the follow. Erica, thanks for the follow. All right, so let's jump to 8, which is a everyone's favorite SATA question. Let's go. Let's go. What's not your fave, Venus? All right, guys, select all that apply. Gotcha. Yep, the select all apply. It is a tricky little guy, right? But after you read the question, the idea is to treat each individual answer as its own true-false question. If it is not true 100% of the time, you throw it the hell out. Okay? You throw it the hell out of there. Okay? This one's a little tricky, but, you know, it is what it is. Clarify the nature of the reports or confusion. So, which nursing actions are appropriate? This one came through weird. Clarify the nature. A, B. All right, it is not going to be D, okay? It is not D. Morphine here is going to cause hypotension and respiratory depression. We're not going to do that one. Let's see. And I apologize for the delay. This one came through a little weird, so I'm doing this one with you guys. So, yeah, so definitely A. Definitely B. All right, because for A is going to reduce platelet aggregation. All right, and that's going to be very important when you have suspected ACS. All right, unless it's contraindicated. A, B, a lot of you are saying A, B, C, and E. Yeah, so yeah. And so C and E. So it's A, B, C, and E. If you guys got that, that is correct. All right, so C, apply oxygen only if the client's SpO2 goal is below the ordered goal. Okay, great. Yeah, oxygen is not automatically given to all ACS patients, but it is titrated, right, to meet saturation goals. And then E, yeah, continuous monitoring, baseline EKG are, yeah, going to be essential here. So A, B, C, and E. Yeah, clarify the nitro order before starting the infusion. All right, I feel like that is, that's appropriate here because nitro can be contraindicated with a recent use of a PDE5 inhibitor like sildenafil, okay, due to the risk of like increasing hypotension. So you got to clarify that order before initiating, okay? So that's why B is going to be included in there. Yeah, that was a tough one. And sorry, so good job, guys. A, B, C, and E on that one. All right. Niner. All right, we got Nurse Bold. Thanks for sharing the live. All right. Nurse is delegating tasks. Love a good old delegation question. All right. All right. Majority of you are saying D. And there's 2 or 3 C's. But yeah, the answer here is going to be D. All right. That task for a UAP, right? UAP, unlicensed assistive personnel, is checking that blood sugar on a stable client. All right. So that's routine. That is a non-assessment task. All right. Some of you put C. No. C is going to be wrong because it's a first ambulation. Okay. After an ICU transfer, post-MI, the nurse should be the first person to assess their tolerance. Okay. UAP, Margin Boo says UAPs can't take glucose where I'm from. That's crazy. All right. Are you here in the United States or is this overseas? Mackenzie says no. UAPs in the NCLEX can. Okay. UAPs on the NCLEX can. So that's the only UAP you need to worry about right here. All right. Question 10. UAP is unlicensed assistive personnel. Think like your floor CNA. Yep, that's right, Morgan. Don't delegate what you can't or what you can eat. So evaluate, assess, and teach. Absolutely. All right. Select all that apply here, guys. All right, we'll let a few more answers jump in here. Telemetry shows new freedom. All right, so answer here is going to be A, B, and E. All right, A, B, and E, okay? For A, loop diuretics can cause hypokalemia. All right, potassium at 2.9 is low. All right, that could trigger PVCs, palpitations, you name it. All right, for B, Loop diuretics can also cause hypomagnesemia. Okay, their MAG is 1.3. MAG of 1.3 is low. Okay, so normal is about 1.7 to 2.2. So low magnesium can also increase ventricular irritability. Okay, and also that refractory hypokalemia. And then E. Okay. Oh goodness. Okay. My computer is wigging out. Stand by. Okay. We need to decrease the number of windows. Okay. So, and then for E, okay, flattened T waves are going to be consistent with hypokalemia and support the suspicion. Okay. Flattened T waves are going to be consistent with hypokalemia. All right, so answer there's A, B, and E. All right, good job, guys. Good job. All right, so let's jump into number 11. Let's try to roll through these a little bit more. All right, so guys, read this question here. All right, we've got 10 questions under our belt. All right. Before you guys get to the answer, do you feel like we need to assess, intervene, evaluate, or teach? What do you guys think? Excuse me. All right. Yep. Right, we are going to be intervening. So which patient are we going to be intervening on? Yep, we are definitely intervening with A. Okay, so they have recent throat surgery. Now they have inspiratory stridor, sitting up and anxious. All that spells not good shit for you. Okay, so either get somebody more nursier than you. Yeah, you need to escalate that immediately. All right. Absolutely. So stridor after thyroid surgery suggests that there's some sort of airway compromise from probably some laryngeal edema or some sort of expanding hematoma. Okay, so you need to intervene immediately. Airway first, rapid assessment, call for help, right? And then you can do the other routine stuff. All right, good job, guys. Hell yeah, that's what I'm talking about. All right, question 12. All right, a nurse preparing to administer IV potassium chloride to a patient with a small bowel obstruction who has had several episodes of vomiting. The client's NPO with an NG tube to low suction as receiving maintenance fluid. Potassium order reads KCL, 40 ml equivalents IV times 1 now. What is the nurse's best action? What's going to be the nurse's best action here, guys? Do we... all right. All right, I think we're getting a majority answer here. There's mostly B's, a couple A's. Yeah, we need to verify that shit, right? We need to verify B. B's the answer because potassium chloride is a high alert medication. All right. It's literally the medication that they use during lethal injection when they execute inmates, okay? They sedate the inmates, all right? And then they give IV push potassium chloride to stop their heart, okay? So anything dealing with potassium chloride, you need to verify that order, okay? Yep. Hamdi chose the safest option because that's all the NCLEX is testing is your ability to keep this one patient safe in a vacuum. Okay, pick the safest answer and then clock it, baby. That's what I'm talking about. All right, 13. 13. Yes, we are always clocking it. I am well aware of my audience's demographics, so we are leaning into it. All right, 13. That's right, Emmy. That is right. All right, is this patient stable or unstable? Right, this patient is unstable. So we need to, if a patient is unstable, you read that question. All right, hey, patient's unstable. You say to yourself, okay, well, I need to do one of two things. I need to either assess or intervene. Okay, so here, do we need any more information? No, we don't. So we are going to intervene. So you should be able to read that question, and before you even look at the answers, you say to yourself, I need to look for an answer choice that is an intervention, right? Okay? Drop a thumbs up if that makes sense. If your patient's unstable, after reading the question, okay, you need to probably be thinking about, I am looking for an answer choice that is an intervention. Everything else can go to hell, okay? So yes, the intervention here is we need to stop the DILT drip. Okay, they are unstable. They have symptomatic hypotension, bradycardia. All right, so shortly after giving this med, it requires you to intervene immediately, all right, by stopping the likely cause and then stabilizing perfusion by you probably sitting them up, all right? Frequent vitals, prepare to escalate if needed, right? All right, good job. I see lots of thumbs up, so hell yeah. Let's rock it. All right, 14, one of your favorites, okay? Again, SATA. So read the question, all right, and then treat each option as its own true-false question. If it is false, if it is not 100% true, it is out. Don't even consider it. The answer for 13 was B. The answer for 13 was B. All right. While you guys are thinking about and answering this question, I do custom NCLEX study plans. All right. They are available in the link in my bio. All right. They are custom, built to you. I turn them around in 24 to 48 hours. They are $25. There's quite a few of you in the chat who have study plans. All right. So if you are interested in a study plan, drop an ME in the chat. Me. Drop a me in the chat. All right. So I can perfect. There's a lot of you in here so far. All right. If you guys are interested in a custom study plan, and then the couple of you, the few of you who have custom study plans, please, you can, here's your to chime in on its benefit. Okay. But go to the link in my bio, either when we're done or you can do it now. You can go up here and you can go to get your custom NCLEX study plan. Okay. And you fill out some information and then I'll get it back to you in 24 to 48 hours. Okay. All right. You guys are awesome. And I'm seeing a lot of correct answers. So answer here is going to be A, B, C, and E. So very, very good, guys. All right. So A, Okay, C. diff requires contact precautions, right? B. Let's see. So B, the priority in the moment, right, is going to be preventing a fall. So directing the client back to safety and using non-skid footwear is an immediate intervening action. Okay. C, yep, alcohol sanitizer is less effective against C. diff. And E, spore-forming organisms require sporicidal cleaning. Okay, usually bleach. Okay, so answers A, B, C, and E. All right, very good, very good. All right, 15. All right, yeah, Mimi. Good job, Mimi. Good job, all. Okay. Okay, client's pale, school. So we're looking at our patient here. Are they stable or unstable? Before you drop an answer, are they stable or unstable? All right. Yeah. So I would probably lean. Blood pressure is coming down. I'd say they're leaning more towards unstable. Do we have enough? So we're saying they're unstable. We're either going to assess or we're going to intervene. Okay. Do we have enough information to really do anything based on these answer choices? No. Okay. Here we need to assess. Okay. We need to assess first because we are lacking objective information. So if you look at the answer choices with a mindset of, okay, I'm going to be assessing, I need to pick the answer that assesses, okay, then you're going to be jumping on B here, okay, inspecting the groin. That is the answer that makes the most sense here, okay, because groin pain or feeling fullness there with hypotension. And cool, pale skin suggests that there's some sort of probably retroperitoneal hemorrhage. Okay, and then they're especially on heparin. On heparin, guys? Come on. Come on. Come on now. All right, thanks for bearing with me. All right, guys, 16. Let's do it. Let's get into it. I've seen a couple custom study plans come through since we've been talking about it, so you will not be disappointed. And I appreciate you guys trusting me with that. All right. Thank you guys for the follows. Thank you guys for sharing the live. And if you guys are new to what we're doing here, we do these lives every Sunday, Tuesday, and Thursday at 9 p.m. Eastern. So if you haven't already followed, you go ahead and follow up here. All right. Join the crew. Yes, absolutely. Nadia, you can absolutely purchase after the live. 100%. All right. Yeah. Let's do these questions. Thank you guys for all the follows there. All right. The majority of you are jumping on C here, and that's going to be correct. That is an overwhelming response to C. So awesome job there. Yeah. Nitroglycerin can cause hypotension and syncope, right? So we need to sit first. And then it's a contraindication with a PDE5 inhibitor, okay? Due to, again, that profound hypotension risk. All right. So we had a question about that with that earlier. All right. So this requires you to teach, okay? So this is a question where you should be able to read the question and think, all right, well, I've got a stable patient. And can you guys hear me? Essential Life says, you can't hear me. Give me a thumbs up if you can hear me. Okay. Essential Life, you need to fix your audio. Everyone else can hear me. Perfect. Okay. So if you're about to pick an answer, all right, let me lower this down so you can see my damn face. Okay. If you guys are going to pick an option choice, that has you teaching, okay, that patient better damn well be stable, okay? They better be stable and they better be boring, okay? Because that is the only damn time you are teaching a patient on the NCLEX, okay? I love you too in the chat. I didn't see who you were, but I saw the love, all right? So, and I saw that study plan order come through. Good for you, all right? Again, we are not teaching unstable patients. Get that thought out of your mind. All right. If you are about to pick an answer choice that you're going to teach, you better make sure that that patient is stable. Okay. That's it. I mean it. You see these eyes? Don't freaking do it. All right. Stable and boring. All right. For the people in the back. Stable and boring. 17. Let's go. Let's go. The kind of music just soothes the soul. I have never been a fan of my nose, but it is what it is. All right. Are we going to assess? What was the last answer? Oh, I'm sorry. I did not tell you. Shit. I'm sorry. Last answer choice. Let me go back to 16. 16 was C. 16 was C. Okay? There you go. 16 was C. All right. 17. All right. What are we doing? Are we assessing, intervening? You read that question. What does it want you to do? Yeah, there you guys got it. Chuchi, I have some recordings up over on my YT. Okay, it's the no-no word here on TikTok. But it's over there under Nurse Jimmy Official. Okay, so check out those live recordings over there. Okay, can't say any no words here. All right, so yes, correct. We are going to intervene. Okay, we should read that question and think, I need to. Yes, Maria, I am a little behind on getting those up. Sorry, I'm working on it. And so, yes, the answer here is B. Okay, apply oxygen via nasal cannula. So the client here is showing opioid-related respiratory depression, right? So the nurse here must intervene. We need to support oxygenation, right, and then rapidly reassess the respirations to determine if that PCA needs to be held. Okay? So, good on you. All right. 17, we just did. All right, let's jump to 18. Good job, guys. Good freaking job. All right. All right. Appreciate you guys answering each other's questions in the chat because I do not have a ton of time to jump through what's being said there. So, all right. So we've got question 18 here. And after you read that question, let me say here. Yep, morning labs, heart failure. Okay. Do we need to assess, intervene, evaluate, or teach? Right? I think based on what all you were saying is that we need to intervene, right? So absolutely, we need to intervene. And again, holy moly, there's, again, a question about digoxin and its basically its issue with potassium if the potassium is not within a normal range, okay? So again, yes, we're going to hold. B is the answer. Bravo. Hold the digoxin, notify the provider, okay? And then anticipate potassium replacement orders. Why? Because hypokalemia increases digoxin toxicity risk, okay? All right. All right. Let's go. 19. All right. Boom, boom, boom. Correct, Nat. Hypokalemia increases digoxin toxicity risk. All right. So we have a patient with a GI bleed getting a unit of red cells. They now report that they feel hot, scattered hives on the chest. Vitals are stable. Lungs are clear. Client denies any back pain or shortness of breath. What are we doing? What are we doing? Somebody said that we are intervening. Good. I love that we would be intervening here. Okay. Yes. Here we are going to, we are going to do B. Okay. Stop the transfusion. Maintain IV access. Okay. Because here we're talking about some sort of blood transfusion, allergic reaction, allergic transfusion reaction. Okay. So even if it's mild and vitals are stable, you got to intervene here by stopping the transfusion first. All right. And then follow your protocol, right? Notify the provider, blood bank, administer probably an antihistamine. So that is what you need to do there. Okay, this is different than when you see a question about like vancomycin and red man syndrome. Okay, for that type of issue, we are just going to slow the transfusion rate. Okay, if things are generally stable. Okay, so there we go. All right, 20. All right. Here we go. Question 20. All right. So, I feel way better. So what are we doing here? Are we assessing, intervening, evaluating, or teaching? All right. Are we assessing, intervening, evaluating, or teaching? Okay. Which action best supports safe discharge planning? Okay. So we generally have a stable patient here. However, we're not really intervening. We're not really assessing. Okay. In this situation, we would be evaluating. Okay. So a rebound weight gain with returning crackles suggests maybe some incomplete diuresis. The nurse has got to evaluate the trends. Okay. That's what this question is getting at. I can see how some people would say, oh, I need to assess for additional fluid reaccumulation. But here this question is asking about evaluating trends like weight, lung sound, symptoms, okay? And then coordinate education and escalation to prevent any sort of readmission or decompensation, okay? All right, good job, guys. Good. All right, let's keep it going. We've got about 9 minutes. All right, let's see how many more we can get through. Yeah, the answer to that one was B. Correct, that last one. Question 20 was B. All right, and again, if you got... Maria says these are a breeze. All right, Maria, got you. if you guys are new or just joining, we are doing some NCLEX study questions. We do these lives every Sunday, Tuesday, and Thursday at 9 p.m. Eastern. All right, so feel free to go ahead and follow if you're not currently following so that you can be in the know. All right. And over on my main page, over on the profile page, there's also a bell in the top right of the page where you can select to be notified every time I go live. So that's an option as well. All right, 21. Here, guys, what are we doing? Are we assessing, intervening? We are intervening. All right, and yes, the answer is going to be B. So I'm going to roll through a couple of these. How many more can we get done in the next 8 minutes? All right, this one was pretty straightforward. All right, 22. Let's go. All right, I'll give you guys 20 seconds. Rapid fire. 20 seconds. Can you hear me? If you guys can hear me, let me know. Give me a yes in the chat. Keita says she can't hear me. Yep, okay. Keita, the problem is you. Sorry. All right. All right, 5, 4, 3, 2, 1. Yes, the answer is C, okay? Melina, right, suggests GI bleeding. So we need to assess immediately for their hemodynamic stability, okay? Bleeding severity and any safety needs. All right, this person could shit the bed quickly, right? All right, let's keep going. 23. Let's go. 20 seconds. Let's drill to see how fast you guys can get the correct answer here. Read the question, determine if they're stable or unstable, and do they need to be assessed, intervened, evaluate, or teach. Okay? Read the question, and before you even look at the answers, ask, what role am I playing? Do I need to intervene or assess? Okay? 5, 4, 3, 2, 1. Answer is A. Yes. Check the most recent potassium and mag levels. Hold the Johnson. Okay? Because why? Diuresis can drop potassium and magnesium, triggering PVCs, increasing digoxin risk. All right? So yes, you need to assess the electrolyte status and rhythm trends before giving a medication that can worsen dysrhythmias, all right, in the setting of those electrolyte issues. Good freaking job, guys. All right, 24. Thanks for the follow. Leroy, Audia, thanks for sharing the live. Much appreciated. All right. Let's go. All right, Etzel, thanks for reposting the live. All right, what are we thinking here, guys? What are we thinking? Okay. This is generally for RN, but there is some PN overlap for sure. All right. All right, I'm seeing some A, C, and E, some A, B, and E. All right, 5. Get your answers in. 4, 3, 2, 1. Let's go. Answer is A, C, and E. So if you got that right, give yourself thankful hands in the chat. All right. A, right? Because early ECG is going to help identify ischemia and infarction and guides urgent management. Okay. C, the aspirin. It's going to be foundational therapy, right? Unless it's contraindicated. So verifying safety is required before administration. And then E, morphine can lower BP and affect respiration. So reassessment is going to be necessary for safe administration. All right. So good job, guys. 25. Kristen, thanks for the follow. Much appreciated. But you was small before I get on the floor. Don't break me down. Sorry, bear with my weirdness. All right, 25, guys. 25. 5, 4, 3, 2, and 1. Fantastic job, guys. Yes, the answer is going to be A. We need to intervene with this patient, okay? We need to intervene. All right, they are unstable. Something needs to be done. If we have all the information we need to intervene. So what are we doing? We are applying oxygen, elevating the head of the bed, calling the rapid response team, okay? So this is pretty indicative of a pulmonary embolism, okay? So a couple of you called that out in the chat. Absolutely right, okay? So we need to intervene immediately to support oxygenation. All right, fantastic, guys. We are about to the end here. All right, if you guys, a few of you were talking about the custom study plan. If you guys are interested in the custom study plan, drop a me in the chat. We will go over that real quick on how to do that. All right, so you guys are awesome. Nadia, no. All right, so real quick, thank you guys for joining. So stay with me if you are interested or just want to chit-chat for a few more minutes. So here, guys, on my profile page, okay, if you go to the, Sunday we'll be live Sunday. Go to the link in my bio, okay? And then from there, it's the first link here. All right, I'm going to open it in the new tab. All right. And then you just fill out the information. That's all it is. Tell me your name, email, which NCLEX you're taking. If this is your first time, if this is your first time, that's great too. Okay, this is made for first-time test takers as well. If it's not, give me a little bit of information about your CPR. What sections did you score above the passing standard, and which did you score below the passing standard? Okay. After that, tell me what your test date was. Okay, tell me what resources you're already subscribed to. Okay, because the study plan is going to tell you how to use whatever resources you're subscribed to. And then any content areas you feel that you're especially weak in. Okay, then finally, tell me how many hours each weekday you're available to study and how many hours each weekend you're able to study. Okay, so I'm looking for like 6 hours every weekday or 3 hours every weekend. Okay, and then also tell me which days of the week you are available to study. Okay, and I even include test anxiety. So I'll give you some strategies on that. And then there's a spot where you can put anything else that you have on your mind or anything else that would be helpful in me customizing this to your situation. Okay, so that is all there. Link in my bio right there. All right. Right now, also, there's the NCLEX Vault, which is free. Just needs your name, email, and then access now. Okay. And then that will take you, let me pull it up real quick. So that will take you to the NCLEX Vault, which is about 232 pages of cheat sheets. Okay, so flip you back around here. So that's there, and basically it's everything that you really need as far as cheat sheets go. There's a little how do you use this, how do you use the Vault, okay? And then one of my favorite sections is this strategy corner. Okay, it talks a little bit about the NCLEX And then one of my main method, which I had come up with, the action framework on how to answer every single type of NCLEX question. Okay, this is going to be applied to every question. All right, your standard multiple choice. And look at this, guys. Right in here, we were talking about this. All right, unstable patients means no teaching ever. Okay, you need to either intervene or assess, right? So all that information is in here. Some tips about SATAs, case studies, bow ties, drop downs, drag and drops, all that's there, along with all of these different content areas, okay? And then with that, there is also a quiz, a 25-question quiz of increasing difficulty in every single section, okay? All right, so that being said, that is it. So you guys are welcome. Check out the link in my bio. I'll get those study plans back within 24 to 48 hours, and that'll do it. So thank you guys for joining. If you haven't already, I'll give you another 10 seconds. You can go ahead and follow up there. Again, we are live every Sunday, Tuesday, Thursday at 9 p.m. Eastern. All right. So with that, I will see you guys on Sunday. Per the request, we'll do a little OB paired with something else. Okay. So Maura says, is it a easy study guide? I mean, it's clear, it's easy to understand, but it's comprehensive. Okay. It usually comes out to about 9 pages or so, but it is very specific and customized to you. Okay. So that is it. I will see you guys all Sunday. Be on the lookout for any new videos on the page. All right. Until then, bye, guys.